Today's didactic presentation entitled Identifying Mental Health Symptoms in Adults with Intellectual and Developmental Disabilities, Team Member Roles and Tools will be led by Dr. Andrea Whitwer, the Director of Training and Outreach and an Associate Professor in the Department of Psychiatry and Psychology here at the Ohio State University Nighsonger Center. In today's session, our learning objectives will be to describe the role of different team members in identifying mental and behavioral health, identifying screening tools and resources to support across different levels of cognitive functioning, considering different communication abilities. Also, like you to be able to list some preventative environmental strategies to promote mental health and identify potential resources in your own region. At this time, I'll invite Dr. Whitwer to share her screen and lead us through our first session.
Hey, everybody. Okay, hopefully everyone can see it. Yes. Somebody nod and tell me they're seeing the right thing. Slides. Excellent. Slides are moving. That's the next thing I've often found I need to check on. Fabulous. Well, thank you everybody for joining us. This is a lot of objectives to get through in about 20 minutes because we want to make sure we have lots of time for case discussion. So what I'm going to say to all of you is let's make this as productive and helpful as possible. One of the awesome things about this Echo and why it's one of my favorites is we have lots of different folks that work with people with a range of intellectual developmental disabilities and autism. We have service coordinators, we have mental health professionals, we have direct support professionals, we have medical professionals. So this presentation is really about thinking from mental health from everyone's lens, not only for you to think about what your role is, but to know what everybody else's roles are as we get through this. And not that they necessarily are for sure, like you have to just do this, but it gives you a way to just frame it. You're all here because you know mental health is important. I'm not going to spend a bunch of time reading these stats to you. I think these will be great for all of you to have as you need to frame and think about things, but we do think about this scope. You know, we know that between 10 and 60% of adults with intellectual disability will have a mental health problem. So odds are, even if you don't necessarily think you work with folks that have co-occurring mental health conditions, you do. We know that adults with autism also are significantly at risk for a lot of different types and a range of mental health conditions. And they have lots of impacts. So it increases a lot of risks. We know that folks with intellectual developmental disabilities are, because of their environment, at risk for mental health, then mental health puts them at even more risk. So framing, as I said, that probably was more than anybody actually needed because you all are here and showing up. So let's really dig into the meat of it and why it's just so important. When we think about that idea of identifying symptoms, getting folks on the road to getting a diagnosis and getting them linked with the appropriate treatment, it's really this whole team approach. We need to make sure that the individual themselves feels comfortable sharing what's going on in their lives, how they're feeling. Parents, caregivers, if they're involved in the person's life, providers, direct support professionals, as well as others, educators, natural supports, other treatment providers. Everybody has a really important role. And I think it's helpful to frame this when we think about how, you know, a lot of folks with disabilities aren't necessarily in a position that they get to access their own mental health services on their own. They're relying on people to recognize things, to really initiate those referrals. And so all of the folks in an individual's life play a really significant role to identify and catch early what's going on. What often happens, and when we ask a lot of mental health professionals, is that they see families maybe not asking for that outside help until things become overwhelming. And so our goal is, how can we catch things early? This is a concept, diagnostic overshadowing, that I think everyone in the field needs to know and think about. It's been around for a long time, just after I was born, actually. But what this whole idea of diagnostic overshadowing is this idea that folks attribute all of someone's difficulties to their disability. So it's this thought that, well, if someone doesn't have interest in things and is sleeping all of the time, well, that's probably just because they're an adult with disabilities and they're not in school anymore. No, that's not accurate. The person doesn't just engage in self-injurious behavior because they have an intellectual disability. It's because of a co-occurring mental health condition. But what often happens is that those psychiatric symptoms are just lumped in with the developmental disability. And it impacts not only if us identifying when an individual is having difficulty, but it can impact how a case is thought about and how we treat a case. There are tons of evidence-based treatments out there, but if we're not thinking that an adult has major depressive disorder or social anxiety disorder, we're not thinking about it that way. If we're thinking it's about the disability, we're not getting that person those supports that they need. So we really need this coordinated idea from the very beginning, from symptom identification all the way through, where everyone is really paying attention and sharing their concerns. So when we think about concerns, what are specific concerns that might raise questions that teams should think about? If we see someone who's crying, sad, irritable, we see a decrease or an increase in sleep, decrease or an increase in appetite, participation in their daily living skills, decrease interest in activities or previously enjoyed things. These are all red flags that we as a team should be thinking about so that we can make sure we're addressing them. And I think it's important when we start to see these changes from baseline. So a lot of these are decreases or increases. How long has this been going on? Or has it been going on for so long that we are not sure whether it's the DD or that have we ever really looked at depression or just always assumed that's part of the individual's autism? No, these things are not necessarily things that are related just to someone with autism. These also, by the way, while these are kind of ways that we think about it within people with intellectual disability, these are pretty line up with mental health in the DSM-5 and how we think about that. Think about anxiety, worrying. So worrying about upcoming events or activities. This might show up and look like someone who's repetitively questioning things, seeking reassurance over and over again. So those are some of those things that begin indication of some of those cognitive or thought symptoms of anxiety. Physical concerns, difficulty falling asleep, jittery, increased fidgetiness, clinging to others. These are things the research say can be ways that we can see symptoms showing up of mental health conditions. So when we see these types of symptoms, we want to think about it and approach. And what I'd like us as a group, as we move through all of these different sessions, is to think through the help model. So again, I recognize that these might be in individuals' mental health conditions, but we also need to think about some other things. Is someone increasingly irritable because they have an ear infection? Are they hitting their ears? Or do they have a toothache? Are they having GI upset? This can cause some of those things that I talked about and can be addressed very quickly with an appointment with a physician. What's going on in the individual's environment? Have there been changes in the supports around the person that maybe cause this repetitive questioning? Have the expectations changed with an increase in setting or work environment, other things? Have life experiences gone on? Have there been things like a trauma? Have they had an accident? Have they been a victim of some type of trauma? Have they lost a support person, which can be the same as grief and loss related to losing a loved one? And then when we've moved through and thought about those things, then we start to look at the individual's psychiatric disorder. So we want to definitely be thinking about that mental health, and all of these things on this list help us think about mental health. But it's really getting down to that psychiatric disorder. We need to rule out some of these things. While we're thinking about this help, on the other side, you see things we can do to address it and things we need to think about, such as the individual's strengths. What are their vulnerabilities? What are the different things that might have caused the person to be going through these different things? What are things that are going to keep going on? And then I want each of you to think about your role. So if it's a person who's with the individual every day, it's paying attention to those sleep, just being able to identify that if someone is sleeping more or less, changes in their hygiene, their self-care, all of these things can help in making sure that the individual is getting to their appointments. There's a lot of different tools to help you with that. We're going to go through those at the end and they'll be listed. And it's this idea of just really learning about symptoms, attending appointments, looking and making sure medication is being used appropriately. The service coordinator may not have that daily living skills or daily in contact, but they can assist with finding mental health professionals, assist with supporting those direct service professionals to understand if a different type of support or care or crisis planning needs to help. Do this by meeting with them regularly, letting them know about, again, doing things like you all are here, learning about knowledge, advocating for the individual. If you're seeing maybe some of that, that type of diagnostic overshadowing going on, revising the individualized service plan, which is that plan that's going to help the team know what are some of those changes that might act as triggers, what are the individual's mental health concerns. And then we think about the mental health professional. If you are getting someone referred, we want you to use standardized measures. There are some that I have on my resources that I'll share, and we're happy to help you think about ones. There are some developed for folks with developmental disabilities, supporting that whole team and thinking about it, and then implementing and connecting folks with evidence-based treatment. So we want to think about things like also educating the team on mental health, helping to provide things that also promote mental health in addition to those evidence-based treatments. And then here are some of those tools and supports that I talked about. So the Glasgow scales and anxiety and depression scales or rating scales. There's some great adapted ones out there. We have practice guidelines, a lot of other resources such as our website, other things where you can provide some of that, get some of that education for yourself and for others. If you want to do crisis planning, that's here as well. Another thing that can help folks when they're communicating with their professional is to use the My Mental Health Therapy Toolkit, which we developed here at Niswonger Center with the help of our very own Christine Brown. You see she's our star on the next one where there's how-to videos on how to complete the mental health therapy toolkit. And it really helps folks to fill out some things to think about what they want to take when they're talking to their mental health professional. Also some ideas on what evidence-based treatment should look like and some tools for therapists as we go through. We do have the whole listserv or the whole list of videos that are there that you could see how to complete them. Here's an example of what the mental health toolkit looks like that can be used to help facilitate from those different team members communication so that and enable that individual with IDD to be able to communicate. Here is the resource that I shared. That's our website where there's a lot of different resources related to this as well. We have recordings from previous echoes here. Another awesome resource is the Link Center, which is a government, the ACL funded center that provides a number of other resources. They have fabulous crisis plans and clear language. They offer more shared learning groups. It's a different model than ours. It's a little bit less interactive, but they really target a lot of different topics, digging into mental health professionals. One of my newly found favorite resources is the Adult Down Syndrome Center Resource Center that has a fabulous visual supports for folks with Down syndrome, as well as anybody else who likes visual supports. There are therapy-based visual supports, adaptive behavior visual supports, lots of great stuff there. The other thing that everyone can do, and I promised I was gonna not overtalk, and here I am talking a little longer. Andrew's already trying to figure out how to adjust our schedule. But it's, you guys give me a thumbs up, is to practice and model positive mental health for yourself. And so one of the ways that I like to do this is to just show some of the really cool ways that you can just do some really basic stuff that has been effective for adults with autism and managing aggression, anxiety, and a mindfulness strategy called the Soles of the Feet. So we're going to do this. Plus, it's Monday. Mondays are hard. So what I would like us to do before we go into questions, so you guys can all be mindful and want to ask questions and participate in our case study, is to do the soles of the feet. So what we want to do there is, if you are sitting or standing, I want you to just try to stand in a rather natural setting. I want you to breathe naturally. Now, what I want you to do is shift all of the attention to the soles of your feet. Slowly move your toes. Feel your shoes covering your feet. Feel the texture of your socks or your hose, the curve of your arches, the heel of your feet against the back of your shoe. If you don't have shoes on, feel them on the floor or the carpet. Keep breathing naturally and focus on your shoes, your feet, until you feel calm. And what we do is we can practice this with adults with ID, and we can tell them that whenever they're starting to feel not so great, they can concentrate on this till they're calm and then walk back to the incident that they're in. So the more that we can model these types of soles of the feet, equal breathing, box breathing, these are things that we can help our folks really promote positive mental health, and within each other help take care of our own mental health, because it can be kind of rough to be working with folks. So with that, I'm going to stop share. I know we don't have a ton of time for questions, but I'm happy to answer them. And or if there are specific resources that you would like, put those in the chat and we can help to point you towards those, either while we're talking through the case, during the case, or afterwards.
Great, thank you.
Andrea and everyone, I just sent something in there about a research opportunity, sleep and safety monitoring. That's a very interesting thing. And even if somebody, let's say they were starting to have an anxiety attack or something, this thing could catch it. So please watch the video and check it out, okay? I wanted to share that.
Great, thanks, Christine. And I
Thanks.
see a question here. Will all these resources be available to you? Yes. So if you log into iEcho, the slides will be right there. You can get that immediately. And then within the next few weeks, we'll also post things on our website. And I'm also happy, for the sake of things, to just post some links in the chat so you can check those out immediately if that would be helpful.
Yeah, thanks, Andrea. Someone else had mentioned getting a copy of the PowerPoint for reference. I had also mentioned that it will be housed in the iEcho. If for some reason you'd like that emailed directly to you, have problem accessing it in iEcho, let us know and we'll email it directly to you. There was another mention in the chat maybe that you can speak to, because you had mentioned the importance of using standardized assessments, and Nazra in the chat had mentioned, I've heard that people are self-diagnosing without being sure with ADD and ADHD. Would you like to speak to that challenge in the field?
Yeah, for sure. I think there's a great thing out there that there's a lot of knowledge circulating about mental health conditions. And so some folks they may read and think something really describes them. There are a lot of internet screen myself for a disorder type of checklists out there. And so I think there is value in identifying that there might be a concern, but I think there's also that importance of then going to a licensed professional to make sure that other things are being ruled out. Like I said, the health, is there a reason for maybe a symptom that's health related? Or is there overlap, say, with anxiety and attention problems? So I think there's a lot of value in recognizing, hey, this might be an issue that's causing me some challenges, but I really want to make sure that we're getting folks the right treatment.
Yeah, Aaron mentions, TikTok and social media have led to a lot of people self-diagnosing and refusing to move forward with anything and any suggestions to overcome this. I've seen this myself and working with transition aged youth and college students as well, because they come from either a family where they have siblings that are older than them that have been diagnosed, and they exhibit or identify with common symptoms or conditions and characteristics, and so they begin to identify as such. I don't know, beyond um, sharing the importance of formal diagnoses to getting the help that may be required, right? Access to medication. Any other tips that you'd like to share, Andrea, on this?
Yeah, that's so I think when I think of a lot of autistic individuals, folks who've gone through the formal diagnostic process, and then those that have maybe self-identified via the internet, and they are identifying, there can be a positive thing to finding a culture in folks that you identify with. And so when we think about like folks that identify as neurodivergent, I think there is value in that social community. And so I will often say, if you find support there, that's great. But then the caution becomes, don't then, if you want to work towards treating something like an anxiety disorder, depression, something of that, there's research that says medication and therapy can be very important and helpful. And so I think there's positive to that social support, but really working with someone to talk about how it might be helpful just to really understand everything that's going on so that we can best support that person. And that's where a good comprehensive evaluation, whether it be even with starting with your family physician, I think that's another kind of good advice point, Andrew, is if folks are maybe like, oh, I don't know about going to a social worker or a counselor, a psychologist, maybe just starting with the family physician, who are they're very good at kind of walking through those initial steps. Yeah, and I think you're right. The labeling and stigma is part of it. And so I think part of it is normalizing, like it's okay. Lots of people go through times when, you just need a little bit of extra help. And maybe even sometimes just using those words versus like, I think you really need to go get a diagnosis of major depressive disorder. That may not be the way to do it. But if you say, I hear you're really struggling, and I wonder if your doctor might have some things that might be able to help you. And that's what I know we've spent a lot of time talking about, maybe not using that label, but using the challenges that are going on, right? I see you're worrying about a lot of stuff right now. Whereas I think you have anxiety. That's different, right? I'm worried about you because you just seem on edge right now. And those might be ways to help encourage someone and or a family member who's feeling hesitant to take their child, to get their child labeled, or they're worried about, what types of treatment.
Yeah, I mean, beyond getting access to the resources that might be really beneficial in helping you, I think there is a lot of positive movement in the social model aspect and the sense of positive identity of recognizing, but it's not labeling, but it becomes a part of better understanding and being aware of who you are as a person, and also understanding that this umbrella of neurodivergence, of having a brain that develops and thinks and learns differently than others, can be a positive sense of identity. But again, using those formal assessments, speaking to someone and encouraging someone to really truly understand how their symptoms or characteristics or behaviors that they're exhibiting are actually aligned to a specific diagnosis, then you can learn more about it and really gain better awareness, understanding of yourself and how to engage and interact in this world. So I invite anyone else, if you have questions, to put those in the chat. And we'll continue on with our session. So I'd like to